Hello and welcome to a new video on our unitology series where we are explaining unitology in a very smart and easy way. Today's topic is the obstetric brachial plexopathy, which is a type of peripheral nerve injuries that occurs in neonates, and it includes two famous lesions called Erb's palsy and Klumpke's palsy. So let's discuss them in short. First of all, why is it called obstetric brachial plexopathy? Well, it's because it's a brachial plexus lesion that occurs during birth. The Erb's palsy is by far the more common type, and it is a lesion of the upper ventral rami of the brachial plexus. However, the Klumpke's palsy is less common, and it is a lesion of the lower ventral rami. For each of these pulses, there will be a specific deformity. Here it's called policeman or waiter step hand, and here it's called the claw hand deformity, as we can see later on. There's a note here that the Klumpke's palsy is usually associated with Horner syndrome. So here are two pictures of the Erb's palsy and the Klumpke's palsy, where the Erb's palsy is called waiter step hand or policeman hand, and the Klumpke's palsy is called claw hand deformity. We all know the brachial plexus, right? It is the network of nerves that sends signals from the spinal cord to the shoulder, arm, and hand. So, the brachial plexus is responsible for supplying motor and sensory supply for the shoulder, arm, and hands. It is composed of roots, trunks, divisions, and cords. So, the part of the roots here is the part of concern, or the part involved in the obstetric brachial plexopathy. 5 roots contribute to the brachial plexus, which are C5, C6, C7, C8, and C1. So there are 4 cervical roots and 1 thoracic root. These two together are called the upper ventral rami of the brachial plexus, and these two are called the lower ventral rami of the brachial plexus. So the upper ventral rami are the location of injury for the Erb's palsy, while the lower ventral rami are the location of injury for the Klumpke's palsy. So, if there is injury of the upper ventral rami of the brachial plexus, then Erb's palsy results, and if there is injury of the lower ventral rami of the brachial plexus, the Klumpke's palsy results. Type of nerve injury might be stretching, rupture, or avulsion. Here's a nice illustration of the Erb's and Klumpke's palsies. As we can see here, in the Erb's palsy, there's increase in the angle between the neck and shoulder, resulting in traction or stretching or avulsion of the upper ventral rami, which are C5 and C6. So it is sometimes called the upper brachial plexus injury. However, in the Klumpke's palsy, which is sometimes called lower brachial plexus injury, there is excessive upward pulling of the limb, leading to stretching or avulsion of the lower ventral rami, which are C8 and C1. Here are two pictures of the Erb's and Klumpke's palsies where we can see the specific deformity here. Here, the upper limb drops beside the trunk, is internally rotated, and the rest is flexed. However, in the Klumpke's palsy, which is called the claw hand deformity, there is paralysis of the hand muscles leading to absent grasp reflex, as well as weakness of the wrist and finger flexors. Here's a picture of the Erb's palsy where we can see the damage of C5 and C6 nerve roots, resulting in the specific deformity we talked about. Now we can talk about the Klumpke's palsy. As we said before, it's called the claw hand deformity and it is associated with wasting of the forearm muscle. So, what is the kind of treatment we can provide to this patient? Well, a patient with obstetric brachial plexopathy will receive first line of treatment including supportive treatment and physiotherapy. The main of this treatment is to prevent stretching of the paralyzed muscles, and by the massage and exercise, we aim at making the muscles regain their function, hopefully. However, if the paralysis persists for 3 to 6 months without any improvement, then there will be surgical intervention, including neuroplasty, nerve grafting, end-to-end anastomosis, and neurolysis. So, the prognosis depends on whether the nerve was merely injured or lacerated. If the paralysis was due to edema or hemorrhage into the nerve fibers, then the function is restored within a few months. So, this is the good prognosis here. However, if there is laceration of the nerve fibers, then permanent damage occurs. If you want further reading on the treatment of obstetric brachial plexopathy, please visit Orthopolis. To sum up, the obstetric brachial plexopathy is a type of injury of the peripheral nerves that occurs in neonates. There are two common palsies here, which are Erb's palsy and Klumpke's palsy. The Erb's palsy by far is the more common type, and it affects the upper ventral rami of the brachial plexus, including C5 and C6 roots. There is a specific shape of deformity, which is the upper limb drops beside the trunk, is internally rotated, and the rest is flexed, so it's called policeman or waiter tips hand. However, the Klumpke's palsy, which is less common than the Erb's palsy, affects the lower ventral rami of the brachial plexus, where paralysis of the hand muscles occur, leading to absent grasp reflex, and also there is weakness of the wrist and finger flexors. So it's called the claw hand deformity, and it is commonly associated with Horner syndrome. Thank you for listening. Please subscribe to my channel if you like my content, and goodbye.